Commission de la santé mentale du Canada, Mental Health Commission of Canada.
I'm Brittany Howell, and I'm the research coordinator in Roots of Hope Burin Peninsula. It's a very rural area in Newfoundland and Labrador, so there's around 40 communities there, less than 20,000 people across all of those communities. The Burin Peninsula was actually the first community to sign on to Roots of Hope, and it was actually because there was a spike in suicides a few years back, so that was kind of noticed, and the Burin Peninsula was like, what can we do to address these suicides?
My name is Evelyn Tilley. I'm a manager with mental health and addictions with Eastern Health in Newfoundland Labrador. It was a good timing when Roots of Hope was announced through the Mental Health Commission of Canada, and we felt that that gave us a framework from which to work. So we formed a group on the Burin Peninsula, a mental health coalition as well as an advisory group, and really focused in on what we could do to, prevent suicide in the area and promote wellness.
My name is Danica Ward. I am the Community Suicide Prevention Coordinator with the Roots of Hope project on the Burin Peninsula. I think one of the biggest impacts that we've taken away from the Roots of Hope project is that suicide prevention is everyone's responsibility. And I think members of the community have seen the positive impacts that can result when community members work together and come together to accomplish a common goal.
We have so many people on the Burin Peninsula now who are very involved in suicide prevention, very involved in mental wellness. They're doing their own mental wellness in their communities within the groups that they're involved in.
We've been very fortunate to see such an overwhelming positive response from individuals. And people are saying and saying in interviews and saying to us that this is making a difference. We have newfound knowledge of ways that we can help. Overall, it's been a very positive experience from beginning to present.
In rural communities, sometimes there's thoughts that you have to be more silent about suicide, and it's something that you don't talk about. And there's the myth that if you talk about suicide, that it will incite other people to do it. But that's not true at all, and that's something that we really try to show in our workshops and our conversations, that it's important to talk about suicide.
We really had to get the conversation going. We had to continue the conversation, find champions within the community, and through all of those means, we were able to break down some of the stigma that surrounds suicide. The other barrier that we faced was geography. The Burin Peninsula is quite spread out, and so one of the positive things that came out of COVID was the implementation of a lot of virtual presentations and infographics. So our reach really expanded for COVID. And through networking too, we went to the communities instead of expecting individuals to come to us. So those are the barriers and some of the ways that we helped overcome some of those barriers and challenges.
The one piece of advice I'd give to communities looking to implement Roots of Hope would be to do it. And that is the same exact response I've gotten from most people that I've interviewed in my evaluation interviews with Roots of Hope. Everyone is seeing the impact, and they're seeing these conversations that they've never seen before, and they're talking about how the Burin Peninsula and Newfoundland and Labrador as a province, and I think even Canada, is ready to talk about suicide.
Now that we've worked out some of the kinks in terms of the startup of the project and the rollout, I think that it is a beautiful made in Canada model that works for the people because it's receiving input from the people. So made in Canada, nationwide project, and the model is close to perfect, I would say, when it comes to meeting the needs of the population. So if there's ever an opportunity to do it, I would highly, highly recommend it.
Commission de la santé mentale du Canada, Mental Health Commission of Canada. commissionsantémentale.ca